the way 3D dentistry has created just a total windfall for the majority of practices, whether it's specialty or GP. And with that, along with digital dentistry or digital workflow dentistry, is using medical billing for it. People don't know, or people are frightened, or maybe they've just misunderstood about how it works. The biggest challenges for people who have heard of medical dentistry is the basic legwork beforehand, knowing the tools to use and getting the accreditation, because you got to be accredited to bill, and you got to use the software. You got to use medical specific software. So that's the two things hand in hand: 3D dentistry to make the dental experiences more of a wow factor and more of a fun experience, and then utilizing their benefits, their medical benefits, to get it paid for. I mean, that's the biggest thing. Is most people, maybe 15%, can afford a full mouth rehab. If you just incorporate medical dentistry for just the ones you can qualify, you'll jump that number to about 35 to 40%.
The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow, because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm so terrifically pleased. I'm so excited. Multiple reasons. One, the Bills won yesterday, but that's just a little thing. The big thing is we have with us today Chris Nevarez. Chris, say hello.
Hello, everyone. I'm so glad to be here. Nice to be with you, Patrick.
Yeah, thank you. I can't wait for our audience to hear what you're going to share today. Before we jump into that, I know in the intro we talked about patient experience through the roof and a windfall for dentists. How can you go wrong with that? You have to listen to this episode. So, Chris, why don't we start out by telling us how'd you get involved in dentistry? How'd you get involved in this business?
It's a little bit funny, and I'll just share that I actually, back when people got jobs by answering the newspaper, that's how I started with Patterson Dental. I answered an ad for a warehouse person, but when I came in, I don't know what, I don't want to give myself any credit at all, but I just told the foreman, or the marketing manager, that my background was customer service, and that at that time they had a position available. So quickly I went from warehouse person to a customer service role in the interview. And the one thing about Patterson, what I learned, two things. I learned that dentistry is phenomenal. If you've ever worked a blue collar job, which I have most of my life before I found dentistry in my 30s, dentistry is, if you love helping people, dentistry couldn't be a better job, in my opinion. It's a dream job for me, and I learned that very quickly. And again, I just started in customer service. They found my knack I was a volunteer for everything. Anytime we had a table clinic or anything where you had to go to a dental meeting, a dental seminar, I volunteered for them all the time. Most people wouldn't, because it was after work and you'd have to go, and I just loved it so much. And that's how I learned a lot of what I know now, is from those old time seminars like Hornbrook and other guys like that. They were telling me their little nuts and bolts. But again, this was back in 2000. So I learned from the ground up as far as digital dentistry goes.
That's awesome. So tell us, what is your role now? I know you've got some amazing things going on, but what are you doing today? What's your focus today?
Well, my biggest focus is to share more about our nonprofit we're starting on our Facebook group. That's my hope, to get some people interested in it, and that's my focus. But more importantly, is helping dentists just deliver more dentistry and make dentistry a better, less fearful experience. Patients have had either bad experiences or they've had painful, or both in the past. And that's oftentimes why most patients either prefer not to go, or when they do go, they're just anxiety ridden. And I think with the tools that we have now, with training and education and the 3D opportunities that we have for virtual patients and all the pluses that go with that, I think you can really give a patient a much better experience. You can do it quicker, like in one visit, which is awesome. And that's the one thing I started on when I came into dentistry, was CAD/CAM was just coming online at Patterson. And I had the pleasure of being able to learn, like, pretty much from the ground up on how CAD/CAM software and the whole process of scanning and planning worked. And I think that's one of the main things that I love about 3D, is how quickly you can deliver dentistry.
Yeah. So, Chris, I know you're a sought after guy. And I know that you're all over the place doing a lot of amazing things. And you're talking to dentists, like most of our guests, you're talking to dentists all the time. What are some of the major problems that you see that dentists are facing right now that 3D dentistry can help them with?
Well, post-COVID, everybody knows they lost a lot of practices took a hit on labor, and they took a hit now with the sundries being as expensive as they are. It's just a double whammy post-COVID. But even before COVID, and I know dentists know this primarily, or if they don't, they should. But I know patients don't know how thin of margins that dentists operate on. They operate on the lowest margin for any healthcare provider. And they don't get the benefit of using the medical system for insurance. And that's something that I'm passionate about, is you could raise your margins very quickly by doing that. But again, that's the challenge with most dentists, I think, is the razor thin margins, and also the ability to have their teams be a unified sales force. One of the things that I do for practices is I help them unify the front and the back office, because oftentimes I've been in dentistry for 24 years. You have the front against the back, and it's kind of this tug and pull type of thing, tug and push kind of thing all day long. For a lot of practices are like that. But if you can unify a practice and you get the same story from the front as you do in the back, oftentimes patients pick up on that, and they understand that if one message is coming through that, you have to invest in your dentistry. You can depend on dental carriers for your to cover it. Many patients will say, just cover what's covered, just do what's covered. And that's something that if you can get that narrative out of the entire equation, you can make it much more easier to sell. Better dentistry, quality dentistry, and also 3D dentistry helps with that a lot, but also patient education. You got to share with patients how the entire process works. Many patients come in, they don't know anything about anything. The one thing they do know is fear, and that's easy. But again, if you make an experience where they can learn while they're there, I think conceptual and causation, patient acceptance that's the best way to do it, is education and causation, because many people don't know the difference between attrition and amplification, erosion type of what causes what. And that's something that I believe if you just taught them. For me, when I came into dentistry in my 30s, I had terrible dental care because I was just like everybody else. I had fear, and I couldn't afford it. And there were a lot of other reasons why I didn't go. But when I came in, I was fortunate enough to educate myself on the process and the causation, because many patients don't know what causes what.
Yeah, and that's some good points you make. And I say this all the time. I think when you see the scene, you start to believe what you see, right? And I think dentists typically see patients that have decent oral health, right, over and over and over again, and they're not really seeing the patients who don't. And I think a lot of dentists think that people have poor oral health because they don't have money, right? And I think that's a big thing. They can't pay, and it's not always the truth at all. I mean, I'm not going to say his name, but he passed away not too long ago. There's one of the richest people in the world that would be on TV from time to time. And you look at this guy's teeth, and they're a mess, right? I mean, just horrible. And he's literally one of the top 10 richest people in the world, and he can afford dentistry. But there's a reason why he wasn't participating in it, right? He didn't see value in it, which is a big thing. A lot of people don't. I know a wealthy person that one time asked me a question about him going to his dentist. Like, I have a clinical experience, which I don't, but he basically said, what is he doing in there? It's like he's digging for gold, right? So in other words, he's just thinking they're trying to find all these problems so they can make money. So some people think that way, but then other people, like you said, have this overwhelming fear, right? And they don't want to confront, and that they don't want to deal with. And that's the reason why they don't want to accept a case, right? They come in for some type of pain. They have a huge treatment plan that they're looking at, or the dentist knows is coming, and they're just like, hey, just get me out of here because this was a horrible experience, or I think it's going to be a horrible experience, and they don't go in. So a lot of education, right? And really kind of talking to some of these patients that are in that situation, I think can change the belief systems of dentists. But what I want to ask you this question, I want to move up to this. So you talked about the windfall, right? And I know that leadership and front and back, communicating well, and really getting great at selling the cases that patients need, all of that is really important. What's something that a dentist can do today that can make that a significant? What's a small step, something minor that they overlook, that they can do today to help increase revenues and better patient care?
I think you touched on it very easily, that multi-billionaire person who didn't value or didn't understand dentistry. I think it goes, if you look at the other side of that coin, the majority of dentists and practice managers and even front desk, everybody, they have the ability, they instantly judge what a patient can afford. And
That's right.
you probably may know this, but practices measure or schedule their time in 5-minute increments. Dentists are the only one who schedule this way. Most medical or other healthcare industries schedule in 10, 15, even 30-minute. Dentists are down to the minute. So if you're going to invest any time in somebody and you prejudge them, you automatically put yourself behind the 8 ball. And I think, like you said, just not judging anybody. I did something that was pretty cool is I put up a post on the top 5 richest people in the world who are just going out to either get a coffee or to just walk out to their mailbox or whatever. And I put it, if you put it next to people who are homeless or who are actually just people, everyday people, I mean, you can't tell the difference because they're just wearing jeans, they're wearing t-shirts, and you couldn't tell that person. What honestly I believe happens is dentists, once they get any pushback from a patient, they throw in the towel and they move on because, I mean, you can't spend a lot of time. And I think that's the one thing that if dentists didn't prejudge, and I believe if you just screened your patients before they came in, used the benefit of e-forms, because that's one thing that I push for medical billing. Everything in medical is electronic. And so medical e-forms, patient communication via smartphones, all that can do great intel work for dentists, because honestly, if you have a patient coming in and you don't do the intel on who's coming in, as a salesperson, before I met you, I knew the name of your company, I knew what you did, I knew how long you've been doing it, and I knew a little bit about this podcast. If dentists invested just a little bit of time in that, maybe on their Monday huddles, or maybe just a day on Fridays when they have more time where they can go over the following week's schedule, that would take a big chunk out of misjudging. Because honestly, a person could walk in and maybe that person can't afford the dentistry, but they have somebody within arm's length that will pay for it if they just say, "Hey, can you help me?" Because honestly, oral health, and this is one thing that I go back to medical dentistry, medical billing for, everything ties back to systemic health, and that's why it's covered right now. 10 years ago, when the AMA said cardio is connected directly to perio disease, that's when they made it a mandatory coverage. The problem is that dentists don't know that you need a physician's referral. I'm sorry, patients and dentists don't know. You got to have a physician's referral for a primary problem. And I always say if a patient has sleep ducts or TMJ pain, that's your best one. It opens the door for a CBCT. Anything you can diagnose, you get to treat.
That's fascinating. That's in my head is kind of spinning a little bit. I want to touch on something, a lot of CE happens in Las Vegas, and I think that's a pretty good place to point out, like, that billionaire compared to the homeless person. Walk by some of those high stakes rooms and look at some of the people that are betting 10, 20, 30, 50, $100,000 a hand, right? And look at what they look like. I mean, that's a great point. They're not screaming money, right? It doesn't, right? Billionaires, right? And multimillionaires for that matter, they typically don't wear their money, right? They don't drive their money, right? Their money's busy working for them. So all really great points. I want to touch on a little bit the All on 4 Arches Dentures Facebook page. I see you got 5, 6, 7,000, I don't know, crazy amount of people following there. Tell us a little bit about that page and what its goal is.
Well, the primary goal was just to help patients and doctors to collaborate. We got an even split of All on 4 providers and patients. We have about 80% are in the US and about 15 to 20% are international, mainly from the UK, Europe, and Australia. That's our bulk. And I'm sorry, and Canada as well. I don't want to leave those guys out. But that's the basic gist of it is I wanted a place for them to collaborate because dentists, again, they have a hard time taking the time in their office. If you can get them in a forum and where patients ask really good questions, they can answer those patients' questions. They can maybe offer a referral for their office, and a dentist can take away that, hey, these are the questions that patients are asking. These are the questions patients want to know. That was the main part of it, was to just give more patients education on the basic All on 4 process. Now, many people don't know that All on 4 is just a catchphrase. I often associate it with 2 for 20 from Apple.
Right.
because
BOGO,
you get everything kind of in one shot. And that's one thing. But many people don't know there's 2 steps below and there's 2 or 3 steps above that you can go. So the all on 4 is basically just saying you're going to get a full mouth rehab. This is it. And that's the gist of it. But what many people don't know is when you hear 40,000, because that's about what they start at, about 40 to 45,000 for a quality. Because remember, you can get it for 20 or 25 places. But again, are you getting quality? I don't think so. In my opinion, I've been doing this long enough to know that you can't cover your overhead, you can't pay a quality lab, and you can't use quality materials if you provide a all on 4, 6, or 8 for $25,000. You just can't. Now you can do other stuff. You can do hybrids, which they can be a step below, or you can even do snap-ins that come out. The main thing that patients and doctors need to know in this group is just getting an implant stops bone loss. Just getting one implant will stop a eighth of or half of a quad from bone loss. You put 2 in that quad, and then you now have a stable quad for bone. And once you stop bone loss, you stop a lot of other things. You stop by stopping bone loss. You also stop face mask, because you lose face mask when you lose bone, and you have a lot of other facial anomalies that come from it. TMJ actually is a big contributing factor to, or a big symptom of bone loss, because people, when you don't have teeth, whether you have none or whether you have some, your mouth is always trying to put itself in neutral alliance at night. And if you have no teeth, it's searching for that alliance all, through the night. Your jaw is constantly flexing, and it's constantly looking for that sweet spot, if you will.
Yeah. Chris, awesome stuff you got going on. If anyone from any of our listeners want to get in touch with you, what's the best way for them to do that?
The best way to get in touch with me is my email or my cell phone. I mean, honestly, I work off my cell phone. I don't take my cell phone into practices with me. That's the one thing I've always been doing for 20 plus years, just because having a phone go off in the middle of a conversation is probably the rudest thing you can do. And I learned that early after paying $20 at our monthly meetings. Every time a phone went off, you'd have to put a $20 bill. And then it was a good thing, because they used that money to help pay for company picnics or they cater in food. But honestly, that's something that I don't do. But my phone is my best way, my email and Facebook. Honestly, if you go on the Facebook and tag me or just instant message me, I work a lot off Facebook and also off of LinkedIn. I have a LinkedIn page. And honestly, my LinkedIn page, I have a blog, a daily blog that I do on LinkedIn for pretty much anything that's new in dentistry or anything that helps contribute to patient experience. That's something that I often contribute to LinkedIn is just the patient experience, helping doctors see through patients' eyes, because I believe more doctors saw through patients' eyes, I think you'd see a lot better communication, because that's the one thing that most offices lack, is just that basic communication. And that's, again, one of my passions is communication with patients. Smartphones, I mean, are phenomenal in that way, because a lot of patients, I don't care if you're 80 years old, a lot of patients now are texting and they're sending emails, etc. The one thing they don't like to do is they don't like to download apps. So if you can do anything without making a patient download an app, like a text, or even if they're on Facebook, I have a lot of patients that are over 60 and 70 who have Facebook, and they love it. They use the iPhone to talk on the phone. They even use the video app to talk on as well. Yeah. So those are points.
Chris, what is the best email address to use to get a hold of you?
It's patient, and it's abbreviated PT, the number 2 PT, dental consulting @gmail.com.
Awesome. Chris, thank you. So much information in such a short amount of time. We appreciate you coming on. Thank you so much for being here.